In this video today, we're going to talk about, can neck instability seem to be occipital neuralgia? If you had this question posed to you, and I'm sure you're thinking about it and it's relevant to you, I'm sure you've already figured out, of course it can. We're going to give you the explanation and reason as to why that's the case. If we haven't met, I'm Dr. Orlando Landrum. I'm a physician that helps patients understand their options for being able to figure out how to be able to deal with pain, whether it's physical or mental, and how to be able to treat it and treat it with significance that is sustainable and get your life back the way that you want to be able to lead your life the way that you deserve. Today, we're talking about instability within the cervical region, meaning in the neck, and what can be done in order to be able to try to address whether it's a nerve problem or whether it's a joint problem. So let's talk about some of the aspects of what is cervical instability and what is occipital neuralgia. So cervical instability is, in essence, the joints that are present in the neck are not stable, kind of part of the name, right? So in essence, what we mean is that the vertebrae, which we're going to explain and show, don't sit correctly or have the potential to not stay where they're supposed to stay for a number of different reasons. And because of that, it can result in pain. Occipital neuralgia is a fancy terminology that basically states that the nerves that are present at the back portion of the head, also known as the occiput, is inflamed or it has a problem with the nerve that is now causing shooting, tingling, lancinating pain as is traditionally classified in the textbooks. And so that also is in the back portion of the head and has different reasons and rationales for it occurring. So let's look at a quick little model that sort of shows the aspect of the cervical spine and the neck. So we're going to pop this up. One of the things that we can kind of see is that by looking at where the cervical spine exists, we can see that this area over here is the back portion of the neck. This area over here is the front portion of the neck. If we were to go up here, it would be the top portion near where the head is. If we were to come down over here, it would be the front portion of the chest near the shoulders. Over here, if we were to come back over in this area and region, it would be the back portion of the shoulders. So one of the things that we want to see and identify when we look at the spine is the following. So we want to identify exactly what is the spinous processes and how they can be the initial aspect of what we see from superficial to us going deeper. So if we're to see that pen tip kind of like travel in that distance, one of the things that we want to be able to identify is from spinous process back. And the area where the tip is right now, where that red is pretty close to the cervical facet joints. And those joints can be culprits. They can be the originators and cause of pain. And those joints have different names as we go higher up into the spine because they function in a different way. But be that as it may, let's talk a little bit more in depth and detail and show you some pictures that represent that better. So the cervical facet, as shown in this picture with the circle around it, and having the arrow going into the area is that what allows for us to have articulation, to have motion, where we can turn side to side, where we can go up and down, and those motions are key. However, that facet doesn't always stay where it's supposed to, and sometimes it can also get arthritis that's there, and it can result in pain. The normal carrier for us understanding where that pain is present are the nerves that are associated with the joint, and they look something like this. Have nerves that go back and feed into the area of the joint. There are different treatments for that. If you have watched our channel or you want to learn more about traditional cervical facet or cervical arthritis and the standard old school kind of traditional way of treatment, like quote unquote burning the nerves or radio frequency ablation, we can explain that to you in one of the other videos. Check that out. But in the short term, we're going to talk about the aspects of the joints, mainly in the aspect of it being mechanical and the mobility that's present. As an aside, for those of you who are looking for other therapies than just an ablative technique, we have videos to explain why you should consider it and why ablation is not always the answer and can cause problems and issues and what might be useful instead of this. But let's talk a little bit about instability as a whole. So let's say we took a look at this model. We can see that range of motion that's present with that extension and flexion. We can see the vertebral bodies can potentially be able to slide. And that sliding can cause problems that are present not only at the joint, but in the areas that are associated with it. So let's pivot for a second and talk a little bit about occipital neuralgia. So occipital neuralgia, as we can kind of be able to take a look from this picture, is a picture that shows this back portion of the head in relationship to these nerves that are present. And these nerves come out, as we showed for the facets, but they also go up into the areas of the head. And there's different nerves that do that. But this is the typical distribution or sensation that someone would feel with occipital neuralgia. So let's say we were to kind of take a look at this in a little bit of a closer up view. If we were to take a look at this model, it shows the back portion of a skull in a relationship to the upper cervical vertebrae. And so if we're to take a look at that, we can see that the cervical vertebrae are present here. And if we're to come down here, the occiput is present here. And if we were to move, we can see where the nerves are present within the areas of the occiput and where they seem to start to land. But what we're going to identify is actually they start closer to the vertebrae than what we expect. You can see in this model the yellow structures, which represent the areas of the spinal cord and the nerves that come out from in and around that area. And the red structure is a vertebral artery, which is an artery that's pretty darn important because it provides blood supply to a number of different structures that are present. So let's go back to the graphical representation that we had before. So that way we can kind of explain this from the areas of deep, superficial, and how it all relates. So this picture shows a cutaway of the muscles. So just underneath the skin, we have muscles like the trapezius. We have muscles like the semispinalis. We have muscles like the obliquus capitis. And those muscles overlie areas of the nerve that we discussed previously, which is the greater occipital nerve. And that, as you recall, is in close approximation to the vertebral artery, that red structure that we showed on the model not so long ago. So let's show this with a little bit more color so you could be able to kind of understand it a little bit better. So if we were to show this, we can see this model that shows the area of the skull, the two different vertebral bodies that we pointed out before, with both the atlanto-occipital joint as well as the atlanto-axial joint, and the muscles that overlie them. When we put this in relationship to the nerve, we can see, oh my gosh, we got muscles and nerves and everything just kind of all bundled up here together. And that is the impression and the point that I really want to make, is that where the joints are in relationship to the nerve is very, very close. So let's take a look at this again. We can see that yellow structure, which is a occipital nerve, greater occipital nerve. And then we can see these muscles that are present and how close they are to the vertebral artery, as well as how close they are to the joints. And this is where we can see really and get a very good impression of how important this overlay happens to be. So let's take a quick look at a deeper picture of the joints and why we might have instability. So here we can see on the left-hand side, the atlanto-occipital capsule and the axial atlanto-capsule, as is defined in this particular picture, which are the joints that are in place, and the ligaments that can hold them there, like the transverse ligament and the alar ligament and these other ligaments that help keep the structure of the neck, particularly the superior or the upper portion of the neck, stable. When those ligaments are disrupted through either degeneration or trauma, it can result in a number of different problems and issues. And that discussion in terms of treatment is one better for another video. But at the end of the day, those ligaments help keep that stability that's in place. We take a look at the picture of the neck from the side, we can see other ligaments like the posterior occipital atlanto ligament that's in place and how it also helps provide that degree of stability that's present. And when that stability is not present, it can cause instability that can occur. In addition to the nerves from the occipital nerve, we also have a cervical plexus that sits in and around something that's called the sternocleidoid mastoid, which is one of the big muscles of the neck, that supplies areas in the back portion and the front portion of the head and around the jaw. And so these nerves are just as complicated, can cause other issues and challenges that are in place. So going back to our color picture model, we can see again the overlap from the AA and AO that is pretty darn close to the greater occipital nerve and where those areas fit in the areas of the head. So when we are looking at a potential occipital nerve issue, or we're looking at a potential cervical joint issue, we need to be looking and identifying both. And one of the main reasons for that is maybe it's not just either or, but it could possibly be both. And if that's the case, then we need to put treatments together that address that. If you found this video helpful, please hit the like button. If you have questions, concerns, comments, things that matter to you, leave me a comment below and give me some idea about what are some of those questions and what have you experienced and how this has been impactful to you or someone you care about. If this video is something that you're like, you know what, I like understanding this a little bit better, please hit the subscribe button and maybe even hit the bell icon so you can be notified about getting videos like this, so you can help understand what your options are, why this is giving you a problem, and how you can be able to get your life back by punching pain in the face and getting back to doing the things that you want to be able to do. Thank you so much and have a great day.